What we do in Peru is something that you cannot describe. You have to be there to see how happy the people feel.
Dreaming and working together started off with Hernando Garcia going on his own. He collected money by recycling cans. That was the first trip. Then he got Dr. Wakefield and Dr. Bass, and it was a team of three. And Karen Brecker and myself joined Andy Wakefield to their next trip. I think it was 2006.
Dreaming working together does prosthesis. We do spine work. We do spine surgeries. We go to extremely poor people.
You know, we hit the ground running when we first get there. I truly have never worked longer hours or harder, but it's so rewarding. We initially, when the patients are fit with the prosthetic devices, we teach them how to put on and off their devices, how to care for their residual limb. So it's all what we call, in the therapy world, activities of daily living.
Hartford Healthcare Global Initiative is a project that's going to help facilitate providing health care around the world and around the United States. With Working and Dreaming, we've partnered with a hospital in Callao, which is outside of Lima, the Carrion Hospital, which is a community-based hospital. But in partnering with the hospital, we've been able to elevate their care. Actually, they've elevated and improved their ORs. They've bought new equipment, anesthesia machines, x-ray machines, microscopes.
That is what global health is all about, is providing care for these folks, but also training them so they can sustain that care and expand on it.
I was the first occupational therapist that they've ever invited. This was my second year. A young 19-year-old, very active, athletic boy lost his right arm due to a car accident. He was fitted with a prosthetic device, and within a day or two, we were playing volleyball, he was playing baseball, he was picking up a pen, and he was writing his name.
I had a guy with bilateral above knee amputations. We fitted him with prosthesis and he stood up. And his 5-year-old son was always with him while we were fitting him and everything else. And he said something in Spanish. And I said, "What did he say?" And he actually said he had never seen his father standing up. So that was amazing. That was really amazing.
It's awesome, because without us, that wouldn't have happened. He wouldn't have had access to the device, to the training of using the device.
Doing these projects outside the country, like what we do in Peru, it's easy to start. It's very difficult to sustain. So that's where Global Health is looking to try to really be an organizer. And I go back to, again, a facilitator on what can we support, what can we sustain.
We make a difference, and that's why we go back.
You want to know what I dream is? It's amazing what I dream. It doesn't have a limit. I wish I can say this is the end, but it's not.